Hello, Elizabeth. Thank you so much for being with us today and for sharing your insights.
Thank you for having me.
Um, I'm really looking forward to this conversation. Thank you for being here. Before we get into the question, Dr. Elizabeth, could you share a bit about your background and the kind of work you're doing?
Sure, I'm a doctor of chiropractic. I've been practicing chiropractic for almost 13 years. I've been doing body work in terms of medical massage. I started that 19 years ago, although I don't practice that anymore. I also have a PhD in somatic depth psychology, and I'm a pre and perinatal educator, a somatic movement therapist, and a 500-hour yoga teacher. So right now I'm practicing as a perinatal chiropractor, seeing preconception, prenatal, and postpartum patients, as well as pediatrics. And I'm an embodiment coach working with embodied leadership and overall somatic and embodiment.
Wow, that's impressive. That's really impressive. Okay, so since we're talking about the parasympathetic nervous system, could you please give like a simple explanation of how the nervous system works and why it's so important to our overall health?
Sure. So for our central nervous system, it's divided into two sections.
Hmm.
We have the sympathetic and the parasympathetic. So most people are going to think about the sympathetic as your fight or flight, but it's also freeze and fawn, fodder, flock. And that's in the middle of your spine from the top of your back, like T1, down to about L2 in your low back, is
Hmm.
where that sympathetic chain ganglion is located. Then we have the parasympathetic nerves, which are more your rest and digest. And those are in your cranium, in your head, cranial nerves 3, 7, 9, and 10, as well as in your sacrum, that sacred flat bone at the base of your spine from S2, 3, and 4. So top and bottom have those parasympathetic rest and digest nerves. And a lot of us just live more in sympathetic dominance, where we're in that fight or flight or whatever your F word may be.
Yeah,
And
yeah, yes,
it's where a lot of people really live because of our society.
of course. I think that would include myself. I find myself quite often to the fight or flight mode.
Mm,
Yeah.
yeah.
So, how can we tell if we're spending too much time in a stress state and not enough time in parasympathetic mode?
Well, I would say if you're living, especially in the global north and in the quote unquote west, you probably are. And it can manifest in so many different ways. When I was a student doctor in chiropractic school, my whole body broke out in hives because I was so stressed out.
Yeah.
It can manifest in shallow breathing because we're not doing belly and diaphragmatic breathing. We're just like we're so stressed. That can happen really tight muscles, soreness, higher blood pressure, pulse. Um, so those are some of the general ways we can notice. Also adrenal fatigue, not sleeping well, not feeling rested, feeling stressed all the time. A lot of people come in, their shoulders are really high up, and I always tell my patients,
Oh, yes.
shoulders are not earrings. So taking a breath, bringing the shoulders up and rolling them back and down so that we can drop further into our body.
This about the heart, you said. I think our skin is always a very good mirror of our emotional state. Yeah, I think so. So, are there any daily practices you can suggest so that people can help activate their parasympathetic nervous system?
Mhm. I would start with breathing, and it could be a really simple square or box breathing exercise where you breathe in for a count of four, you hold your breath in for four counts, then you exhale for four counts and hold your breath out for four counts. So it's 4, 4, 4, 4. That's that square box breathing technique. It's really simple to do.
Hmm.
And that's something that can start regulating your breath, which can regulate your mood and your nervous system. So that's a really good way to check in with yourself when you notice, oh my gosh, I'm so stressed right now. I have this deadline. or whatever it may be. But if you have a minute or a couple minutes, just dropping in and doing that breath can be really good. I often tell people to treat yourself like you're this newborn baby, because a lot
Yeah,
of times what you need is really basic.
that's a good
Maybe you need a
advice.
nap, you need some water, you need some food. So it's like very simple things. And so, hold yourself in that moment of what do I really need right now?
Yeah, this breathing exercise you suggested, I think it's really useful. And since I've been having asthma since I was a teenager, I'm really going to try that. Thank you so much for that suggestion. I think it will be
Yes.
really useful for me. So, as far as I know, you're using hands-on feeling in your practice, correct? So, how does this type
Yes.
of care support the nervous system?
Sorry, can you repeat the beginning?
Yes, yes, of course. As far as I know, you're using hands-on feeling in your practice. And so, how does this type of care support the nervous system?
Ooh, yeah. Well, anytime you have hands-on healing, it's so deeply impacted to the soma, your lived experience. And so you want to work with a practitioner who's really aware and astute of their palpation. And so what I'll do, if somebody's really deep in fight or flight, I'm going to check in with them just while they're seated on my chiropractic table. And sometimes I'll even be like, let's just take a moment to breathe and really guide them through some breath work, maybe a little mindful meditation or a body scan. And then if they're really in that fight or flight, I'm going to only work on the top and bottom of the spine. So if you're looking for something like that, you could go to like a craniosacral therapist.
Mhm.
For me as a chiropractor, I know about 10 techniques. There's over 200 technique
Yeah.
systems within chiropractic. So what I'll use is sacral occipital technique. So the
Mhm.
sacrum, base of the spine, occiput, back of your skull. And so we're really tapping into that parasympathetic. So I'll use these SOT wedges under the pelvis and just allow this really like gentle unwinding of the pelvis and of the nervous system while I do some cranial work and allowing people to drop deeper into their bodies. And that will really help. If they're really stressed, there's no need for me as a chiropractor often to adjust that thoracic spine in that moment. I want to just address their parasympathetic nervous system.
Yeah, because I'm also doing stuff like manual therapy myself. One of my favorite techniques is the technique which is applied on the suboccipital triangle. I really love
Hmm.
to work with suboccipital muscles. Yeah,
Hmm.
it's a technique I
Yeah, I
really
mean, we hold
like.
so much tension.
Yeah, absolutely. Um, I'd like to ask you, what are some like of the most powerful changes you have seen in patients once the nervous system begins to regulate? Like how is that manifested?
When it starts to regulate, you're going to notice, oh, I can take a breath, and you're more aware. And so I think your entire lived experience can really shift when it starts regulating. And people will kind of forget, oh, I was in all this pain. It's only if you remind them as a practitioner that they'll be like, oh, yeah, I did have that pain, or that was really bothering me.
Hmm.
Because, that kind of just leaves their body. So I think people start sleeping better, they'll feel more rested, and those are some ways that can show up and you can start really noticing, oh, I'm shifting. The other thing is we don't want to lose our access to sympathetic nervous system. It's important for certain things. I tell my patients though, I want you to live in parasympathetic, but you need to be able to visit your sympathetic nervous system if you're in danger. And I always joke, like, if there's a saber-toothed tiger, I want you to be able to run away from that or whatever it is. So they get that when you make that analogy, because people know they're really stressed. That's why they're coming in for healing. And you're not even, we're just that access point for them. Their body knows how to heal. So I found that we just need to guide them, give them some homework, and really just send everybody lots of love because everybody seems to be super stressed out these days.
Yeah, it's true. This is something I have observed too. Yeah, it's a strange kind of period in time also, I guess. Many things happening, and people may feel insecure. Um, so I have another question. Like, how does trauma, especially birth trauma or developmental trauma, affect the nervous system? What is your experience with that?
Sorry, did you say birth trauma at the beginning?
Yes. My question was, how does trauma, especially birth-related
Oh,
trauma or
yeah.
developmental trauma, affect the nervous system?
Mm, yeah. So we can have trauma from in utero experiences. If you're like bathing in your mom's stress or anxiety, or your parents are fighting a bunch when you're in utero, you're definitely going to take that on. And we've been able to find that in the research, that the perinatal psychology research. Or if you have a really traumatic birth, let's say there's vacuum extraction. Now, vacuum extraction, like suctioning the baby out, whether it's vaginally or even sometimes through C-section, they'll use vacuum, is a lot of physical trauma on the baby. So when we think about it, when you're getting your blood pressure taken, it's measured in millimeters of mercury. So it usually starts to feel really tight on an adult arm around 200 millimeters of mercury. A vacuum pulling a baby out, like axial traction, is 400 to 600 millimeters of mercury. So think about how much
Wow.
pressure that
Yeah.
is on that baby's head and neck. So that could cause issues to begin with. Or if the baby had a nuchal cord where like the cord was wrapped around their neck, that can be really traumatic. And so I've found that sometimes kids who haven't had any trauma repair work are afraid to lay on my table and look down through the face cradle because, and then it turns out their birth story, they were stuck in the vaginal canal. So that stuff can all show up. So there's organizations. I even have one near me in Southern California that does a lot of trauma repair work from the beginning to recreate that breast crawl for the baby and to give voice. And even when I work with babies, I'll see babies days old in my practice, and I do really gentle adjustments with my fingertip. There's no like manual cracking. I'll talk to them of, oh, that was really scary probably when you were stuck. And I've had babies a week old. I'm working on their neck and they'll just like,
Hmm.
they'll sigh and they'll let it go
Yeah.
and their body unwinds. And it's really beautiful because they're holding so much in them. They're not a blank slate. They have so much wisdom already in their little bodies.
Yes, of course. In the past, I used to work as a medical translator, and I have to say that one of the most interesting books I have ever translated was a book on prenatal psychology that
Mm,
really touched a lot this subject you just mentioned. It's very interesting.
yeah.
Yeah. And so, how do you think that hands-on approaches can help support healing?
I think that we need to be really mindful as somebody who does hands-on healing, whether you're a massage therapist, a chiropractor, and asking questions that are besides like, what's your pain? Asking more somatic based questions of about the lived experience and how is that feeling in your body right now? What are you noticing in your body right now? Are you noticing anything different front to back, left to right? And guiding people into a deeper sense of interoceptive awareness within themselves. And so I think that I know that that can really help. So, and then moving kind of like an elephant where it's like a firm pressure, but you move slowly so that people feel safe. Kind of like when you work, like if you ever ride horses and if you need to walk around the horse, you keep your hand on the horse so they know where you are. I'll do that with patients when I walk around the table if they're prone, face down. I want them to know that they're safe, and I'll name that too, saying this is a safe and sacred place. So I think it's really important to have consent and safety within hands-on healing so that people's nervous systems can down-regulate.
Yeah. It should be a really interesting experience. I've never been on a horse, but it's something on my bucket list. One day I'm definitely going to do that.
Yeah.
Okay.
They're so powerful and embodied. That's an animal we can learn so much from.
Yeah, in the past, I had another experience I had. I used to work as a volunteer for a wildlife sanctuary. This mostly had bird spray, so I mostly worked with bird spray. But some of these experiences were really powerful. So,
Mm.
so I can relate to that.
Yeah, there's so much wisdom. I have a Siberian Husky, and he got hurt last year,
Mhm.
and his whole side was spasming. He had dislocated his shoulder. So first I brought in an acupuncturist, and
Mhm.
when the needles went into his shoulder, this dog just went and just like sighed so loud because I wasn't sure how he was going to do with acupuncture, but he innately got that it was helping him. And I witnessed this dog of mine go from like so much pain, being in flight or flight, to being just present and feeling it in his body. And then I found a chiropractor who specializes in animals because I work on my own dog a lot, but that's not my specialty. And it's helped him tremendously. He's back to his self now, being really active as huskies like to be. But it reminded me, it's just like working on babies too. There's no placebo. So
Hmm.
if we can be really in our bodies and just receive, then we can heal in a different way. Because as adult humans, we often tend to be stuck in our heads. And that's a hard place to be. Like healing's not taking place there. We need to be in our body and our soma.
Yeah, of course. I have also seen that animals respond very well to complementary medicine modalities.
Hmm.
I have observed that myself too. Wow, that was very interesting, Dr. Elizabeth. Thank you so much. Where can people find you on social media? Do you have a website? Would you like to share your social media?
Yeah, social media is the best because my website's about to change domains.
Mm-hmm.
And
Great.
so at Dr. Elizabeth Wisniewski, which I can send you for the show notes, that's the
Absolutely.
best place to find me on Instagram. And from there, there's my link tree so that you can follow along. But I'm most active on Instagram. I'm
Mm-hmm.
also president of a tech company called Dream Planet. And you'll see on my link tree, you can find me right on Dream Planet. And that's for anybody in the creative arts, fans, creators, and investors. So those are really good places to find me and to connect with me.
Okay, I will be sure to share that. So, Dr. Elizabeth, thank you so much for being with us today and for sharing your insights. And thanks to everyone listening. If you enjoyed this episode, make sure to subscribe to my YouTube channel, Flow Arthur, so you don't miss the next one. You can also find my books on Amazon under the name Eleftheria. Thanks again for tuning in. Thank you so much.
Thank you.